Good morning. Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And today I'm going to do a nasotracheal suctioning. And so the first thing I'm going to do is check the patient's chart, and I'm going to notice if they had any surgeries, anything like that, especially for in their nose area, anything like that. So when I'm ready, I'll knock on the door always and introduce myself. Then I'll wash my hands, and then I'll apply the appropriate PPE. So for nasotracheal suctioning, I can place a mask on, a gown, and goggles, anything like that, because you could potentially have splashing sometimes with the nasotracheal suctioning. So before I always do anything, I always want to assess the patient. I want to check their vital signs, and then I want to listen to their lungs before I do the treatment, so I can get an idea of what it sounded like before I do the treatment. That way I can see if it's helping. So I'm always with nasotracheal suctioning. When I'm ready, I always want to hyperinflate their lungs. So I'm going to use this non-breather mask here. I'm going to apply it to there. And so what you want to do is make sure the bag inflates at least to where they partially get the oxygen there. Then you would place it onto them. That way it hyperinflates their lungs. And so with that, you can either do, so like before that, you can also do, if you don't have a nasal trumpet, you can do that. But if you have a nasal trumpet, what you can do before this is apply the nasal trumpet if you have one available at the facility. But what you do is you take it from the earlobe, and you're going to measure it from the earlobe to there. And so you would take a couple different sizes with you just in case, because when you look at the nasal trumpet, you can look at the bevel and see if it matches with the nose, if it's too big or if it's too small. And then you can also tell by the length here is like this. So when you're ready, you always want to look before you place a nasal trumpet into a patient. So looked in there, and I don't see anything, no deviating septum or anything like that. So you want the bevel facing towards the middle of the nasal area there. So then you would lubricate the end of this, and you'd carefully apply it into the patient like this if you have a nasal trumpet. But if you don't have a nasal trumpet, you can just place the oxygen onto them. Right, you go like that, and sometimes with the nasal trumpet, it'll help them open up their airways a little more. That way it can hyperinflate their lungs a little quicker than. Alright, then I would place and get my tray ready. And so here I have my sterile gloves. I get my sterile gloves opened here so that way they're ready to go. I would put my lubricating jelly on the lid or even on clean gauze. And then I'd also place sterile water in with the catheter. That way I re-sterilize it. And then I'd get this ready. I'd turn it on to regulate. Make sure it's connected. And if the doctor needs a sample, I'd also connect another connection to get a sample, a little extra piece here to get a sample of the secretions. So what you do is occlude this, and if it goes too high, then you would lower it down. You don't want to go over -150, so you want to be between -120 and 150, so that looks good. So I'll set that there until I'm ready. And then now I will apply my sterile gloves, so you always want to keep one hand for your keeping sterile and the other hand to be able to grab things like the suctioning, tubing, anything like that. So when I'm ready, I will apply my gloving here. Try not to touch anything. So one thing you want to try to do is put it over your other glove if you can. If you can't see, like these ones are a little small for thing, you can just rewash your hands if you can't fit it over top of the gloving. Like that. And then when I'm ready, I will grab, with this hand, I'll grab my suctioning tubing. And always make sure it's not kinked or anything when you go to take your suctioning tubing. So I'm going to take with my sterile hand, and I'm going to grab my catheter And I'm going to apply it to the suctioning. And once you know you have it connected is when it starts hissing. And so you always need to run sterile water through the tubing to make sure it's working properly. So you're just going to suction it like this. Then you're going to take the end piece of this. You're going to always lubricate it before you put it into the patient because you don't want to cause any trauma to the patient's airways or anything like that. And when you're ready, then you will remove the oxygen source. And then you will get ready and you'll place it into the patient's nasal area, going very slowly, not forcing it in. If it feels forced, if the patient's able to, have them cough, or you can remove it back up. And when you get down to the appropriate place, you want to lift it up a couple centimeters, just so that way you're not hitting anything that you're not supposed to. Then you begin to suction. And you don't want to do it more than 15 seconds in there. So then when you're done, you would slowly remove it like this. You just slowly move your fingers up so that way you don't splash anything like that. And if you need to do it again, then you would put the oxygen back onto the patient and hyperinflate their lungs. You always want to reoxygenate them after you've suctioned them and everything, but you don't want to do it more than 3 times. So assuming that I'm all finished and I got all what I need, then I would remove the catheter. I'd wrap it around this hand carefully, not to splash anything on the floor or anything like that. And then I would remove it with my sterile gloves and everything like that. And then I could place this on here out of the way and remove my other gloving. And then I would wash my hands. Always wash your hands after you do a suctioning. And then I would reapply gloving. And then I would check on the patient, see if their lungs are back to where they need to be. Listen to the lung sounds, see if it's helping them, treating them at all. And then I'd always shut off this. And then if they are finished with the oxygen, then I can remove it from the patient. And I would set it in the appropriate area. And after they look good and they're sounding good, the vital signs are okay, then I would remove the rest of my PPE, make sure I have my gown off, everything is disposed here, and then I would let the doctor know that I did a nasotracheal suctioning with it.